So my last question is about Social Security and Medicare.
Yes.
Now, we just saw a huge battle in the debt ceiling bill, where the Speaker and the House GOP were effectively holding these programs hostage. The future of Social Security and Medicare and its solvency, I mean, we need to fight for it.
Right.
What are you working on here in the Senate to help ensure that that is possible?
Well, first of all, these are earned benefits.
Yes.
And people pay into Social Security, pay into Medicare throughout their working lives. And in my opinion, it's a promise. As I hear my Republican colleagues talk about it as though it was their money, right? Not workers' investments into these programs, we should be outraged. Yes, we have to prolong or increase the solvency for a greater number of years. Frankly, there would be some pretty straightforward ways of doing that with Social Security in particular, because the very wealthy don't pay in at the same rate as others. So there's basically a cap where they stop paying the payroll tax after they've earned that much money. And if we just address that, if we got rid of the cap, it would solve the problem. If we just raised it at a certain level, we could certainly extend solvency. Likewise, with Medicare, the fact that we are now negotiating for lower drug prices, and Medicare pays for a lot of, a share of the cost of medications that seniors and others who are on Medicare receive, that extends the solvency significantly. I am looking forward to, hopefully once we get our foot in the door, if you will, with these negotiations, that instead of ramping them up really, really slowly with a few new drugs every year, let's get in there. Let's start negotiating on a large scale. The savings would extend the solvency of Medicare by many, many years. Plus, people's out-of-pocket expenses go down, just like they have in the case of insulin. Now we need to extend that to so many other medications.
I'm somebody on Social Security disability, and I've said many times to some of your colleagues on the other side of the aisle that it is our money and it is not an entitlement. We have earned it.
That's right. Thank you for sharing that story, your story. I appreciate it.
You're very welcome. Thank you for everything that you do for healthcare, Senator Baldwin.